So in some women, there's a kind of bleeding that could actually occur. That's, should I say, fetal implantation. This is kind of like embryo implantation, right? Yeah, it's embryo implantation. Yes, it's embryo implantation. So sorry, this is embryo implantation bleeding. Okay, it's not fetal implantation bleeding. Of course, we're talking about it in the class, and we're talking about some issues of the mother and the fetus. So fetal, and I'll just put it fetal implantation. But the right thing is embryo, okay? Because the baby at this stage is still an embryo. So implantation bleeding, first of all, you should know that it's fascinating, and it's often misunderstood part of what early pregnancy. Do you understand? Sometimes bleeding could occur and the woman might just take it as what, it's just part of her menstruation cycle or something, and the bleeding usually should not be heavy. All right, so it's a light spotting. It occurs when a fertilized egg attached to the uterus. Okay, so this process can what, disrupt tiny blood vessels, causing a small amount of bleeding, so to scatter how things are being arranged. It typically happens 7 to 14 days after ovulation, which is around the time you would expect your period. You understand? So some people might just kind of like misunderstand it. Okay, so if you had like sex within your period time, if you had this kind of like light spotting, you should be suspecting pregnancy already. So how can you actually recognize this embryo implantation bleeding? For the color, usually pink or brown. It's not typical red like your period blood. Okay, the flow is very light, duration just few hours. Other symptoms: mild crampings, breast tenderness, mood swings, and all of that. So when to be concerned: heavy bleeding or bleeding with clots is not typical and could signal something else. Do you understand? Maybe there's miscarriage or ectopic pregnancy. All right, so that's just it. And when you see something like this and you are like disturbed, the best thing is what, to walk to your health care provider. Okay, so that's it for embryo implantation bleeding.